Good afternoon and welcome to CCK Live. My name is Jenna Zelmer. I'm an attorney here at CCK, practicing veterans benefits appeals at the court. Joining me today are Alex Sachs, also an attorney practicing at the court, and Michelle DeTore, who's an advocate that practices primarily at the agency level. And today we're going to be talking about chronic pain. So chronic pain is something that's really interesting because it affects a larger number of veterans than the general non-veteran population. And chronic pain occurs when a veteran or a person suffers from pain in a particular area of their body for over 6 months. So that lasts longer than the average amount of time that an injury would usually take to heal. And so it kind of manifests, instead of just regular pain due to an injury, into something a little bit bigger, a little bit more serious, what we call chronic pain. And I think what's really interesting about chronic pain is until recently, the court didn't award service connection for pain alone. You had to have a diagnosis. So Michelle, can you give us a little bit of background about how the court and how VA dealt with chronic pain in the past?
Yeah, sure. So I think what's interesting, like Jenna said, it for about almost 2 decades, you were only diagnosed if you would only get service connection for pain, and maybe if you were a Gulf War veteran, because they would, for Gulf War veterans, VA has separate regulations that allow for service connection for an undiagnosed illness. And that's how VA saw it for a very long time. They didn't see it as its own disability. They saw it as a symptom or something that didn't have a diagnosis yet. So what came along in 2018 was the Saunders case. And essentially what it was doing was challenging VA's definition of the first prong for service connection, which was a medical diagnosis is the first prong that a veteran needs in order to get service connection. There are 3 prongs, which we'll kind of talk about a little bit in a minute. So VA always saw that it was a medical diagnosis. You had a disability that was diagnosed. So what Saunders came and did and said that even without a specific diagnosis, disease, or injury, pain alone can serve as functional impairment and therefore qualifies as a diagnosis. So at this point in time, now a veteran could apply for service connection for chronic pain without having an underlying condition that the pain is related to. That alone constituted a disability, which was something that for many years, many veterans, as soon as they applied for, VA would just reject, saying that you don't have a medical diagnosis. So now that kind of overturned, years and years of case law and kind of, how VA saw cases. So this is a very big change for them.
Great. And you mentioned Saunders, and I think I should note that we did have a video a while ago when Saunders first came out. And so it's interesting to kind of look at the past 2 years and see how that particular case has changed the landscape of veterans law. I'd also encourage you to, if you're checking out that video, encourage you to check out our website, cck-law.com. We have a lot of great informational videos about chronic pain and all sorts of different issues. You mentioned service connection. We have a whole video on that. And so please feel free check out our website, to leave a comment in the box below, and we'll do our best to answer any questions that you have. So moving on, Alec, Michelle had mentioned, that the Saunders decision changed an element of service connection. So can you talk a little bit about that? What do veterans need to still prove to get service connection for chronic pain?
Sure. So yeah, as Michelle touched on, there are 3 essential elements to establishing service connection: the current disability element, the in-service event or injury or disease, and then the third nexus element between the current disability and service. So this decision in Saunders really impacted that first element of service connection of a current disability, whereas before you needed to have a diagnosis, like we said, of the condition. Now you can satisfy that first element of service connection simply by showing that you have pain or some other type of symptomatology that is functionally impairing, reaches the level of a functional impairment and earning capacity. So the most common example probably is something like chronic pain. You don't, again, necessarily need a diagnosis of degenerative disc disease or arthritis, or even something like an acute back sprain. If the evidence shows that the back pain is functionally impairing, you don't have the diagnosis necessarily, but you have the pain, and it is functionally impaired, and that's enough to satisfy that first element of service connection. So that said, veterans still must establish the nexus element and the in-service element, the nexus element connecting the current pain and functional impairment with service. And oftentimes this is the most difficult element of service connection to establish. There are essentially two ways, or three if you look at it, to establishing service connection, and that's most commonly through direct service connection. The service or medical records indicating an injury during service and pain resulting therefrom. And the pain would directly limit the veteran's functional capacity. The other option is through secondary service connection, and that talks about pain that is from the service-connected disability causing another disability. And there's another somewhat form of secondary service connection that comes in the form of aggravation. So pain aggravated by service or a service-connected condition. The relevant inquiry is basically whether military service exacerbated the condition beyond its normal progression. I know that sounds a little like a secondary service connection, but there's a small nuance and difference. So it's direct service connection, secondary, and aggravation.
And so once a veteran achieves service connection, how would they be rated? Does VA have a specific diagnostic code for pain?
Good question. So no, VA doesn't have a diagnostic code for pain generally, not per se. Although for orthopedic conditions, you may receive a minimum compensable rating for painful motion. In general, like I said, there is no diagnostic code for pain. So VA generally will look at the symptoms caused by the chronic pain and whether they are rateable under its various diagnostic codes. Oftentimes, this involves comparing the pain with its resulting symptoms to the various diagnostic codes, such as the musculoskeletal system, which is a common example we see for this type of pain.
Great. So I think, for example, if a veteran were to be compensated for orthopedic pain in your previous, example, orthopedic pain caused by military service. So an example of a direct service connection would be once they've established service connection, you establish there's an in-service injury. They don't have a current diagnosed disability, but they have currently diagnosed back pain, and then there's a nexus between that. The VA would maybe, if they're looking at the musculoskeletal diagnostic code, they're going to look at how that back pain limits the veteran's range of motion, because that's what that diagnostic code is really based on. Your ability to bend forwards, sidewards, backwards, rotate your waist, and then VA considers a whole host of factors such as weakness. If your back pain flares up, things like that. That's what VA is going to look at when they're going to rate your back pain. Just the same way as Alex said, if you did have a diagnosis of degenerative disc disease or degenerative joint disease, and that's kind of how VA would rate it. So Alec mentioned secondary service connection. So Michelle, how would VA rate a secondary service connection example of pain?
Sure. So a lot of times when you have a condition, it doesn't necessarily just stop there. So let's say you have chronic pain, and then I'll use an example of medication use. For a lot of, medication is narcotics. So narcotics, a lot of the side effects cause gastro upset. So you have maybe diarrhea, you have reflux. Those conditions can be called IBS and GERD. So what VA does is, if they find that you have that condition secondary to the pain, or in this case, the medication used to treat the pain, they would rate it under a separate diagnostic code for GERD or IBS based on the residuals of that condition and the severity they find of that condition. So I think that it's very important when you are applying for, let's say, your chronic pain, to also think about the secondary conditions that you have that go with the pain, just, for effective date purposes, and to make sure you're getting everything in when you're applying.
Right. I think that's a good point. You mentioned pain, chronic pain pain medication. Chronic pain can also, cause a whole number of other debilitating symptoms. Depression, anxiety. We see a lot of clients with depression because their pain affects their life so dramatically that they have psychiatric symptoms due to that. We have a lot of sleep impairment due to pain. The pain is so bad that veterans can't sleep at night or they wake up due to pain. And so there's a lot of different disabilities that you can link with pain in the secondary world. And then Alec, you had mentioned aggravation as example, kind of as like a similar, well, it is a secondary condition, but it's a form of secondary service connection. So do you have an example of how an aggravation claim would work?
Yeah, sure. So a common example of the aggravation would be a veteran who has let's say, knee injury from playing sports before service. Military service aggravates that knee condition beyond its natural progression. Veteran can have that knee pain service connected by the aggravation. An important caveat to that is this assumes the veteran entered the military in sound condition, and there is a presumption that all veterans entering the military are in sound condition, unless there is a condition noted upon entry, which requires the examiner, the entrance exam, to note it explicitly. So if you had a knee injury for service, but you were found fit for service, and again, that was aggravated in service, you may be entitled the service connection for the pain as a result of the aggravation in service.
Great. So those are kind of the different ways that you can get service connected for your pain. One thing to note, is to really think about how you're going to prove your claim. So it's not enough just to say, well, now VA awards service connection for pain and I have pain, so I should get service connection, right? You still need to prove, as Alec had mentioned before, you need to prove all three elements of service connection. And so, one really important thing the VA is going to consider when it adjudicates your claim is the presence of medical records. That's going to be both service treatment records, and it's also going to be current treatment records. And if you can get an opinion from your treating physician that links that pain to service in one of the ways that we mentioned before, that's going to go a long way to helping you get service connection. What else do you guys think is necessary to prove a service connection claim for chronic pain? Michelle, what do you think?
I think a big thing is that you need to be like you were talking about medical records. You need to be treating for it. You need to be showing that you have the condition. I also am a big fan of lay evidence because sometimes there's gaps in treatment. Sometimes maybe you didn't treat you had an event in service, you didn't treat for many years. So lay evidence can help fill in the gap as to maybe why you weren't treating. It can also fill in the gap to the severity of the condition and to show that the symptoms started in service and continued and didn't just start back up again years and years later.
Yeah, I think that's a really important note. I in our practice at court, I'm sure Alec will agree that lay statements are really helpful in filling those gaps between treatment. And then Alec, you had mentioned before, the need for a nexus and why that might be the most difficult part. So can you talk a little bit about that? What's the standard to prove a nexus in order to get service connection, and why is that so important?
Sure. So the standard used by VA is an at least as likely as not standard, as the pain at least as likely as not related to service or the service connected condition. And it's a fairly liberal standard for veterans as it should be. But again, like I said earlier, a lot of these cases do come down to this third element of service connection. And that's oftentimes the most difficult to show because while we talked earlier about how lay testimony is helpful in discussing your current symptomatology, your pain, especially in this context because VA recognizes that veterans and everyone really are competent to report observable symptomatology, pain being kind of the most obvious one, right? So the medical nexus element is that third step and a lot of times the hardest link where oftentimes you will need a medical professional to provide that nexus because VA assumes for the most part that lay people are not competent to relate a current condition to service.
Great. And I think it's important, to note that often VA will obtain VA examinations to determine if there's a nexus there. And we have a former CCK Live video all about VA medical examinations and what you should do to prepare for them. I think the number one takeaway there is that you should always attend them. And you should always request a copy of them. You are entitled to one. They're not going to give you one unless you ask for it. But if you can obtain a copy of that opinion from the VA examiner, you'll be able to read it over and see, maybe that they wrote down something that you said that you thought you were clear, but maybe it was unclear. Maybe you can respond to that exam to make sure that the VA has the correct information when it's making its decision. So that's really helpful. And so, we've really focused on how to get service connection for chronic pain, but we have a lot of videos and a lot of information once you get service connection, how you get an increased rating. And so we just wanted to touch briefly on kind of evidence that would help an increased rating claim for pain, particularly when a veteran is pursuing TDIU, which is total disability due to individual unemployability. And that is when VA awards you a total rating based on your inability to work due to your service-connected disabilities. And so that includes pain. And we have a lot of information about TDIU. I would say one of the biggest things to note is that the court has recognized that, pain can contribute to inability to focus, inability to perform aspects of work in terms of sitting, standing, et cetera. And so if you do have chronic pain and you aren't working or can't work and think that it's due to that, TDIU is definitely something that you should consider talking to your service rep about, or your attorney, whoever's helping you file your claims. So Michelle, do you have any final thoughts on kind of the TDIU aspect, how to get an increased rating in general?
I think one big thing is a lot of times for the increased ratings and the TDIU is it's not just based on the range of motion for a lot of the pain you see. So I think that, again, I'll go back to the lay evidence and your medical evidence. You want to be showing, what the functional loss is, like your ability to sit, your ability to stand, your ability to walk, your ability just to function on a daily basis. VA is supposed to be considering that. So make sure that you're highlighting that if you feel like you're only being kind of rated based on your limitation and range of motion.
That's good. That's a good takeaway. Alex, do you have any closing thoughts or tips for both either service connection for chronic pain or increased ratings?
I think Michelle stole my thunder a little bit there, but I think it's well taken to not only, divert VA's focus away from the mechanical, we call it application of the rating criteria or diagnostic codes, but to make sure that the evidence is there that shows the limitations in, everyday functional activities, not just work. That's important to know, but to the extent you can show that, it's difficult to sit at your desk all day if you have a desk job due to the pain in your back or your knees. That's great, and obviously, any type of physical type of labor, it should be fairly obvious what type of statements or medical evidence you would need to relate that pain and how it impairs your ability to do that physical or manual labor. So, everything we've said today, I would echo.
Great. Well, thanks for joining us today. As I mentioned, please feel free to check out our website at cck-law.com. We have a lot of information about chronic pain and all sorts of other disabilities that you may be entitled to compensation for. So thanks for joining us today, and we'll see you next week.